Before we go to the questions, I want Dr. Piercey is going to come up to give a brief health update, but we had our largest single day of COVID-19 cases in this past week, and we are closely watching those numbers. Fortunately, we had some much better days following that spike today, but what we're watching for are trends, and we're specifically looking at healthcare capacity, hospitalization data, death rates per capita. Those are the things that are the real manifestations of this COVID-19 pandemic that we are most closely following, and we will continue to do so. So, Dr. Piercey, would you come up and make comments?
Thank you, Governor. Good morning. As the Governor mentioned, we don't have today's numbers yet, but yesterday's numbers were 451 new cases in the context of almost 14,500 tests. As he mentioned, it is a modest but expected increase as people start moving about. And we do see an increase in the average number of daily new cases. Over the last 14 days, our average daily new case count is 615, compared to the prior 14 days, which was 453. We're starting to see these develop in hotspots. And just a couple of hours ago, in our every morning Unified Command Group meeting with the Governor, we started discussions on developing what we're calling a hotspot plan. You'll probably remember that we did that in Hamilton County and Sevier County in the last couple of weeks when we saw increases there. Obviously, that work continues. Most recently, we've seen increases in Wilson and Hamblin counties, and we'll start developing those plans for those spots. The good news is that our hospitalizations and deaths have remained stable in the context of a modest increase of case counts. Currently, COVID patients represent 4.9% of all hospitalized patients statewide. That varies by different geography, but statewide it's still less than 5%. Our hospital capacity therefore remains quite stable. As of this morning, 24% of our inpatient beds were available, 25% of our ICU beds were available, and 75% of our ventilators were available. Why is it that hospitalizations are stable in the context of increasing case numbers? We believe that mostly that is due to a lower age range, but we do continue to watch that. Hospitals continue to remain busy with their typical things. As they resume elective procedures, that increases their typical occupancy rates. We have normal summertime trauma and infections that we normally see in hospitals in the summertime. And then something that has been concerning nationally, and we've seen it here as well, during this entire pandemic, people put off routine medical procedures and even care for things that they should have sought care for, like heart attacks and strokes and even cancer diagnoses. So as people are becoming more comfortable, they are starting to seek more appropriate care. So the bottom line message there is hospitals have plenty of capacity, and the vast majority of hospital beds that are occupied are with typical conditions. Finally, we noticed some interesting information yesterday that I want to share with you. So compared to earlier in the pandemic, when most people got infected from people that they knew, primarily household contacts or parts of clusters, if that happened in their workplace or other particular places, now exactly 50% of cases are from an unknown source. I'll repeat that again. Half of all infections, the people don't know where they got infected. Now that's not surprising because as people are moving about in the community, they come in contact with people that are sick that they're unaware of. But this unknown source tells us that we have more community spread. So that re-emphasizes the point that when you are moving about, and we want you to move about and we want you to feel comfortable doing that, but we want you to do it safely. As I tell you every time, wash your hands, wear your face covering, and avoid crowds when you have to, or when you can, but when you have to, keep your distance and make sure you're doing it safely. Thank you.